If you're a lady between the ages of 12 to 40 years, see, you have to know about Pcos. Whether you've heard it before, whether you've never heard of it before, or whether you've been diagnosed of it before, you have to know about Pcos. Why? Because Pcos is very, very common. And it comes with a lot of complications. See, because of Pcos, you can have heart disease. Because of Pcos, you can have liver disease. Because of Pcos, you can have diabetes. Because of Pcos, you can have cancer, endometrial cancer. So you have to know about it so that you protect yourself. Okay, let's talk about Pcos. Pcos stands for Polycystic Ovarian Syndrome. Okay, now let me explain something to you. There are two main hormones that we are dealing with right now. The first hormone is estrogen. The second hormone is androgen. Okay, estrogen is the hormone in females and androgen is the hormone in males. Now, in females, estrogen has to be high, whilst androgen has to be low. But then there are situations where androgen becomes higher than estrogen in females. So we call it hyperandrogenism. Okay, and when androgen becomes high, it makes those people exhibit symptoms of males. First of all, in males, you know that males have beard, they develop hair around some places, the chest. They have male pattern hair distribution at the genitals. So usually in males, it's sparsely distributed. But in females, it's vein-shaped and then they don't have beard and all. But then when there's hyperandrogenism or when there's too much androgen, what happens is that now the females start developing beard. So you can see some females that have facial hair. She understand. Aside that, because of the androgen, males undergo what we know as androgenic alopecia, where they lose hair. Some males lose hair, especially on the scalp. Okay, so when females do experience this hyperandrogenism, they tend to lose hair. So you can see a female that her hairline is receding or is losing hair. Because the androgen levels in females has become higher than expected, what happens is that the androgen now suppresses some cycles of the females. And the females are not able to menstruate regularly. So what happens is that they can menstruate today or this month. The next time they'll be menstruating is 3 months later or 6 months later, what we know as oligomenorrhea. To diagnose Pcos, so we have three main things that we look at. The first thing is whether you have menstrual irregularities. So what I mentioned, you have oligomenorrhea where your menstruation is irregular if you menstruate today, unless after 6 months or 3 months. The second thing is when you have abnormal growth of hairs, facial hair, male pattern hair distribution. And the third thing is on ultrasound. When we do ultrasound for you, we see a lot of cysts on your ovaries. So it's called polycystic ovarian syndrome because you have a lot of cysts. Poly means multiple. You have multiple cysts on the ovaries. Do you get me? Yes. So that is how we diagnose it. And you need 2 or more of these things to diagnose Pcos. So you can have either the first 2 I mentioned, oligomenorrhea and then facial hairs and those things. And then we can diagnose you of Pcos. Or you can have multiple cysts on the ovaries and any of the above ones. And then we can diagnose you of Pcos. Now, don't be discouraged. The fact that you have Pcos doesn't mean your life has ended or doesn't mean you cannot give birth again. There are treatment options, okay? First of all, so we can group the treatment options based on whether you want to give birth or you don't want to give birth. So if you don't want to give birth, then our main goal is to regularize your menstrual cycle and to deal with the abnormal facial hair and acne and those things. So the first thing is to give you a combined oral contraceptive pill. And this one is going to deal with your menstrual irregularities and also deal with the androgen dependent symptoms. So it's going to take care of the abnormal facial hairs, acne, the male pattern hair distribution, and the rest. Now, the second thing is also to give you a medication called metformin. Metformin is also going to help regularize your cycle and also help you reduce weight because one main factor of Pcos is obesity. If you have fertility wishes, then we have to make you get pregnant. And you know that you cannot get pregnant if you don't ovulate. Okay, so we have to induce ovulation. Ovulation is when you produce your eggs. Usually females produce eggs before the eggs get fertilized and then they get pregnant. So the first thing is for us to induce that process, to induce ovulation so that you can get pregnant. So what we do is that we give you a medication called letrozole, yes, or clomiphene. So this one will help you ovulate. If all these things do not work, I mean your ovulation is not working at all, don't give up because we have what we know as in vitro fertilization, where we take your eggs, mix it with sperms in the laboratory, and then we implant it back into you. Okay, so don't give up. How do you deal with Pcos? The first thing is reduce your weight. Reduce your weight. Reduce your weight, because obesity is a risk factor. Reduce your weight. The second thing is stop eating fatty foods and eating late at night. And when you are eating, please don't eat too fast. When you eat too fast, you don't get enough time to digest your food. So most of them is stored as fat. So don't eat too fast. Pcos is not a death sentence, and it doesn't mean you become barren for life. There are always treatment options. You have to follow whatever we tell you. If you find this video useful, please subscribe, share, like, and comment. Thank you.